I'm Timothy Callaghan. I'm an assistant professor in the Texas A&M School of Public Health, and I am also affiliated with the Southwest Rural Health Research Center. And the title of my talk today is Understanding the Role of Community Health Workers in Addressing the Needs of Rural Americans. Now, in the way of a brief agenda, we're going to be going through 5 key things here today. First, for those who might not be very familiar with the concept of community health workers, we're going to talk through what these healthcare workers do on a day-to-day basis. Then we're going to use some data that I've collected over the past year or so to try and understand community health worker roles in rural and urban America, as well as trying to explore differences between community health workers in urban and rural environments. Next, we're going to talk about some of the key challenges to the growth of the community health worker field and why, even as the field is growing, it's encountering some new growing pains and challenges. And then we're going to highlight some of the efforts that community health workers have put forward to try and combat the global pandemic. Now, for those who might not be very familiar with the concept of community health workers or would like a refresher, community health workers are individuals who help to bridge the gap between the public and needed health and social services. Critically, community health workers stand out from other healthcare workers because quite often they come from the communities in which they serve. And by coming from the communities in which they serve, they're able to promote trust within the community and help connect these vulnerable individuals quite often to the services that they need. The literature on community health workers, as well as our own personal experiences, tells us that community health workers quite often hold unique cultural competence and a personal understanding of the communities and their patients because they come from those communities and they're able to help patients overcome barriers to accessing healthcare services. And what's critical to note about the field of community health workers is that the field is growing quite quickly. I'm coming to you here today from Texas, and in Texas, the field of community health workers has grown over 500% in just the past few years. And the Bureau of Labor Statistics tells us that the field is projected to grow by up to 13% over the next decade. Now, I did mention I was going to be using some data in my talk here today. And we're going to be using 2 sources of data. And this is data that was collected last year with the support of the Federal Office of Rural Health Policy. The first source of data will be a series of focus groups that my research team held with community health workers in rural and urban parts of 4 states last year. Those 4 states were Florida, Minnesota, California, and Massachusetts. And we're also going to be talking about some recently collected survey data. We collected one of the larger surveys that's ever been done of community health workers with over 1,400 community health worker participants. That survey was available in English and Spanish, and we had good representation from states across the country. We had community health workers from 45 states, as well as Puerto Rico and the District of Columbia participate. Now, I gave you a bit of a brief background on what community health workers do, but I think it's important you also hear from community health workers in their own words. And when you talk to community health workers about what they do, they bring up 3 common themes. The first theme community health workers bring up when you ask them what they do is that they link clients to resources. And here are 2 quotes on that, both from California, one from rural California and one from urban California. In rural California, a community health worker told us, we are this bridge between the agencies, their resources, and the community. Promotores, which is another term for community health workers, are very successful because we have this connection with people. We go to their level. We understand the people because we belong to the community. We know their needs, and a lot of the time we experience them. So again, they're talking about bridging to agencies and services. They're from the community. They know the needs of the community, and it allows them to serve with those needs because they experience them themselves. And then another community health worker in Los Angeles told us, I would say linking clients to resources. That would be to providers, whether it's medical providers, dental providers, vision care, where you can get a hearing screening, diapers, whatever the resource the client needs, it's linking them to those resources. Now, while linking them to resources is important, when you talk to community health workers, what's critical is they will tell you that it's not just linking to healthcare resources. More than anything, what they do is help to address the social determinants of health. And this is perhaps best illustrated by a community health worker we talked with in rural Minnesota. And she said, we help with insurance, and then we help with homelessness, and then we help with food, and then we help with moving, and then we help with dental access and behavioral health access, and that's all before noon. Community health workers aren't doing one thing, they're filling in all of the gaps in our social determinants of healthcare system and trying to provide some of those wraparound services and connect people to resources as they need them. And this was also pretty well illustrated by a community health worker in Boston who told us, if you're worried about homelessness, if you're worried about where your next meal is coming from or childcare, or all these things that are directly related to your family, you're not focusing on your health. You're focusing on these things. So that's where we come into play as community health workers. 9 times out of 10, they don't even identify anything health related. It's mostly social. So they're linking clients to resources, and not just health resources, but social resources. And the final key theme that emerges when you talk to community health workers about their day-to-day jobs is that they're going to be able to provide insights that other healthcare providers simply can't. And one of the primary reasons they're able to do this is because they not only understand the communities, but they actually go into the homes of patients. Here's one from rural Florida. Especially if you go into the home, you have the opportunity to see the whole client, not just a COPD, not just a diabetes, not just a person who's vulnerable. You have the opportunity to see the person as they live, and that's something your doctor doesn't get to see, or your nurse in the hospital doesn't get to see. And you get a better understanding of where they are. Critically, as one community health worker told us in Massachusetts, you can then go back and relay that information to doctors and nurses, what kind of problems the patient has. The medical providers actually get an insight into who their patients are, and they get to know them a little bit better because of us. So clearly, community health workers are filling this vital role in our healthcare system, and it's a field that's growing. But the key question is, what role might they be serving in rural America? Well, as you've heard already here today, rural Americans face considerable barriers to accessing healthcare services. These include transportation issues, limited number of providers, hospital access issues, and limited social programs. And if community health workers are really uniquely positioned to help link clients to resources, they might be especially important where those resources are scarce. So the key question, of course, then becomes, well, do many community health workers work with rural clients? And our research tells us that the answer is yes. Here's some of that focus, the survey work that I was telling you about. And in one of the questions on that survey, we asked community health workers whether they worked with only or mostly urban clients or only or mostly rural clients. What's important to note here is that even though 43.3% of CHWs are working primarily with urban clients, a non-trivial portion, in fact, a significant portion, almost 30%, are working mostly or only with rural clients. Now, in the next few slides, I'm going to be talking about rural and urban community health workers. And when I do that, I'm not referring to where the community health worker themselves lives. I'm referring to whether or not they work primarily with urban clients or with rural clients. Now, you might be wondering, where do community health workers work on a day-to-day basis? They're fulfilling all of these various different roles, but who's paying them and where are they working? And when you ask community health workers this question, they'll tell you they're not coming from one place, they're coming from lots of different places within our healthcare system. They're working in hospitals, doctors' offices, clinics, nonprofits, academic institutions, and doing door-to-door outreach in the community. What's interesting, though, is when you break this down by urban community health workers versus rural community health workers, some interesting differences emerge. For example, urban community health workers are more likely than rural community health workers to be working in hospitals as well as out in the community. And this makes sense because in rural areas, there's fewer hospitals to work in, and going door to door in the community is a lot harder in rural areas where people are more spread out. In rural areas, community health workers are instead more likely to be working in doctors' offices and clinics, as well as to be working in sort of harder to define roles, sort of a hodgepodge of different roles that don't neatly fit into these other categories. Now, when you actually ask community health workers about their own demographic characteristics, some other interesting differences emerge between rural and urban community health workers. We find in our data, at least, that rural community health workers tend to be a bit older, which matches what we know about rural America in general. In addition, rural community health workers tend to have lower levels of education. In rural areas, community health workers, about 43% of them have at least a bachelor's degree, whereas almost 53% of them do in urban areas. Now, of course, a college degree isn't necessary to do community health work, but it is sort of interesting that these differences do emerge between urban and rural areas. In addition, while the field is overwhelmingly female, across all data, it's over 90% female, you are more likely to run into male community health workers in urban areas than rural areas. And there are some pretty clear racial discrepancies between community health workers in rural and urban environments. In rural areas, community health workers are almost 70% white, and in urban areas, they're less than 50% white. Now, while those sort of demographic profiles are interesting, what we really care about is what are the differences between the work that community health workers are doing in urban and rural areas. And when you ask community health workers about that, they sort of identify two key things that are different about the work of community health workers. The first idea is the difference between generalists and specialists. In urban areas, community health workers tend to be specialists. They're hired to focus on a specific task, whether that's enrolling individuals in a program, focusing on a certain subpopulation, or focusing on a specific disease like diabetes. On the other hand, community health workers in rural areas tend to be generalists. They tend to have to address all of the needs of the individuals because there are not other equivalent healthcare workers to fill in the gaps for those other needs. And this idea is well articulated by one community health worker in Minnesota. In an urban setting, they're often adding a CHW specialized in diabetes, specialized in prenatal care, specialized in something they can really train that individual on and have a large enough population that they can serve just that population and make a big difference in those urban areas. And I think the biggest thing I've seen that's different for us in a rural area is we have to be generalist. So the specialist versus generalist thing is something we would consistently find in our research. The other major difference that we find is that rural community health workers have to do more with less. In fact, in some urban areas, patients seem to be overwhelmed with the number of resources that are potentially available to them, as was articulated by a community health worker in Boston. Everybody in Boston that has something going on has been offered some kind of program, and really they're so overwhelmed by, oh, I have 5 different programs, I don't want another program. And even in the same state, it's night and day when you go to a more rural area. In rural areas here, there's less transportation, there's less resources, there's less funding. Sometimes it can be trying. We have a program right now that CHWs work with. If you're struggling with food, we can give you a gift card for a certain amount for each person in the house, but that's limited. We can't give it to everybody, and everybody at some point has problems with food insecurity. Even in cases where they have programs in rural areas, they're limited, unlike in more urban areas typically. Now, even as this field continues to grow, and even as we begin to understand the important role that community health workers provide in bridging the gap to these needed resources for vulnerable clients, community health workers will tell you again and again that there's some key barriers to preventing the field from growing in the ways that might be beneficial, particularly in rural America. And while there are a lot of these issues, 2 stand out. The first is an issue related to naming conventions. Our research team, when we started our research in this area, we sat down and tried to write out all the different terms used to describe community health workers, and we found dozens and dozens of them. It's community health workers, it's promotoras, it's health educators, it's health navigators, and there are literally dozens of terms to describe individuals doing similar work. And this is potentially problematic because most of the things that allow a field to professionalize rely on the development of laws in states from across the country as well as from the federal government. However, if there's not a consistent nomenclature, it's hard to know which regulations apply to which individuals and which ones don't. So if a law is passed in, let's say, Texas focused on community health workers, and I'm a promotora or I'm a health educator, does that law apply to me or not? Now, if you talk to community health workers, they will tell you that the biggest issue is actually payment. And the issue with payment is sort of twofold. The first issue is that a lot of the work they're doing is grant funded. And because it's grant funded, there's no long-term security that they're going to have a job once that grant ends. The other major issue is that, quite simply, it's difficult to bill for the social determinants of health. There aren't very good billing codes to try and get payment to help individuals address their social determinants of health concerns. And because of that, many healthcare providers are reticent to hire community health workers because they don't know how they're going to make a profit from hiring these important individuals. Now, lastly, I want to talk briefly about community health workers and how they're hoping to address the coronavirus pandemic. What I think is critical to note is almost as soon as the pandemic began, there have been extensive efforts to train community health workers across the country to address the global pandemic. Here in Texas, the first training was held as early as March 5th. And in South Texas with promotoras along Texas-Mexico border, they also held a training on March 7th. And in talking with the National Community Health Worker Training Center, which is affiliated with Texas A&M, we've learned that the National CHW Association, the APHA CHW Association, and various training centers across the country have been promoting trainings for community health workers to help them fight against the coronavirus pandemic and also to make sure that community health workers are staying safe. Now, if you're asking what community health workers are doing during the pandemic, our research and talking to the National Training Center suggests that they're taking on new and important roles. One prominent role some community health workers are taking on is doing that contact tracing that's vital to understanding the spread of the disease. And what's critical is community health workers and coming from the community can provide that support in a way that's culturally appropriate and trusted, which other contact tracing might not be. We also have some evidence community health workers are doing things like making masks for vulnerable individuals and picking up groceries for individuals who might be too vulnerable to pick up their groceries themselves. And of course, on top of these new roles, they're still performing their old roles while trying to practice social distance. So that has seen an increased use of teleconferencing technologies, for example, to connect with clients. Now, of course, this is not without its limitations. And there have been some particular limitations related to rural community health workers. Most notably, it's hard to practice some of that social distancing using teleconferencing technologies, for example, if your clients don't have internet access, and that's more likely to be the case in rural areas. In addition, as I said, some of these projects, community health workers sometimes have trouble finding work And many community health workers have been laid off due to the reduced funds coming into organizations during the pandemic, as the economy has sort of struggled as the pandemic has gone on. And finally, of course, if it's difficult to bill for the social determinants of health in person, it's increasingly difficult to do so in the context of a pandemic once you're moving online. So overall takeaways, we know that community health workers are trusted community members that help to bridge the gap between vulnerable populations and needed services, and that they could prove to be vital in rural America given the unique barriers to health access there. CHWs in rural areas tend to have less education, they tend to be older, and they tend to work more in clinics than in hospitals. Community health workers in rural environments tend to be generalists instead of specialists, and they tend to have less resources to work with, which makes their job a bit more difficult. I want to thank my collaborators on this project, Dr. Washburn, Dr. Schmidt, the head of the training center, Denise Martinez, as well as our graduate research assistants who helped along with this project. This project was funded by the Federal Office of Rural Health Policy, so we thank them for their support. And here's my contact information if you'd like to reach out to me. So thank you so much.